Hello friends, my name is Touray, a second-year student in physiotherapy. Welcome to Prolific Rehab Sport Physio Clinic. In our today's presentation, we will be talking about fracture types, classifications, and mechanisms. The purpose of this video is to help students with theory examination and viva preparations. In an examination, it is frequently asked this way, in long questions: define fractures and its classification as well as mechanisms. What is fracture? A fracture is a break in the continuity of the bone. Classifications of fracture. Fractures are classified on the basis of etiology, communication between the fracture and the external environment, displacement of the fracture, and the pattern of fracture. We will first start with pattern of fracture for the purpose of these video presentations. First, classification on the basis of pattern. These classified into 5 depending on their patterns of fracture, and they are: 1. Transverse fracture. In this fracture, the fracture line is perpendicular to the long axis of the bone. Such fracture is caused by tapping or bending force. Number 2, oblique fracture. In this fracture, the fracture line is oblique. Such fracture is caused by bending force, which in addition has component of force along the axis of the bone. 3. Spiral fracture. In this fracture, the fracture runs spirally in more than one plane. Such a fracture is caused by primarily twisting force. 4. Comminuted fracture. This fracture with multiple fragments, it is caused by crossing or compression force along with the axis of the bone. 5. Segmental fracture. In segmental fracture, there are 2 fractures in one bone, but occurs at different levels, leading to a free segment in between. 6. Impacted fracture. Impacted fracture occurs when the bone feels or faces compression. A typical example of this will be a depressed fracture in calcaneus when someone falls from height or vertebral compression of the spine, and could also be example of valgus impacted fracture at the femoral neck. So therefore, the different fractures include transverse fracture, oblique fracture, spiral fracture, comminuted fracture, segmental fracture, and impacted fracture, if it is based on the patterns. There is another important fracture which is not mentioned under these types of fracture, which is avulsion fracture. This fracture is caused by ligament, tendon, or capsular insertion. It is mostly occurs as a result of explosive muscular contraction. An example of this is an anterior iliac spina avulsion, which can occur as a result of rectus femoris while kicking on violent joint movement. For example, violent angle inversion can result to the base of the 5th metatarsal at the peroneus brevis insertion. Second classification of fracture is based on etiology. This is divided according to the following. Traumatic fracture. This fracture following the direct or violent normal bone can withstand considerable force and break only subject to excessive force. Example of this is fall from height, road traffic accident, or assault cases mostly seen. The fracture is mostly seen in the following mentioned cases. A fracture in abnormal or diseased bone is referred to as pathological fracture that results from an action of a normal force, an abnormal weak bone. The pathology may localize to one part of the bone. An example of the tumor deposit or generalize, which could be osteoporosis or osteomalacia. A trivial or non-force may be required to cause such a fracture. For example, a fracture through a bone weakened by metatarsus. A stress or fatigue fracture. This results from a cyclical application of normal forces in an excessive to normal bone in a healthy patient, reading in the brain of the bony trabecula. A classic example of this could be second metatarsal fracture of army recruits, and it is popularly known as Mark's fracture, and the fracture of a navicular bone among athletes. Stress fractures are typically seen in military personnel, athletes, or dancers. This is due to the intensity of the exercise from the baseline. Third classification of fracture is based on the displacement. In these fracture types, they are often classified in the position of distal fracture fragments, and they are named as undisplaced fracture. An undisplaced fracture that is not moved from anatomical position and nearly so that is said to be minimal displaced. Likewise, in minimal displaced fracture that is very near anatomically, it is said to be minimally displaced. The next one is displaced fracture. When the distal fracture is significantly displaced from the anatomical position, this is called a displaced fracture. A displaced fracture is described as displacement of a distal fragment in relation to the proximal fragments. Fracture displacement is described in the following: change in length, change in angulation, rotation, and translation. We are going to look how displaced fractures can cause the following mention: a change in length, a position in amount of end-to-end contact of the fracture fragments. B. Bayonet apposition. This means overlap fracture fragments in the longitudinal axis. In this, the bone ends have no contacts and have slip past each other. This is also called off-ended. This is also, as a result, cause a shortening of the limb length. A bayonet apposition gets the name from a bayonet rifle. C. Excessive traction may result from opposite deformity leading to distractions. Angulation. It is described in the referent apex of the fracture in a coronal plane. A fracture with displacement of a distal fragment towards the middle line with apex pointing laterally is said to be varus. E. Another one, a fracture with displacement of distal segment away from the midline with apex pointing medially is said to be valgus. In sagittal plane, the fracture in which apex is posterior, pointing posteriorly, is said to have posterior angulations or to line extension, finally with pointing anteriorly, or a fracture has anterior angulations. It lies in flexors. A fracture may rotate internally or externally, and it is always judged by the appearance of the two bone ends and the position of the distal part of the limb clinically. Translation. This occurs when the fracture surfaces have shifted sideways related to each other, depending on the position of the distal fragments. In this case, the fracture may be translated medially, laterally, anteriorly, posteriorly, by either in combination of these. Fourth classification, on the basis of relationship with external environment. In this fracture, it is classified as a closed fracture. A closed fracture, this is a type of fracture that is not communicated with external environment. That is, the overlying skin and the soft tissues are intact. An open fracture. An open fracture is a fracture that breaks overlying skin and soft tissue, leading to fracture communicating with an external environment. This type of fracture is called open fracture. Fifth classification of fracture, on the basis of complexity of the treatment. These fractures can be classified in the following: simple fracture, complex fracture, complicated fracture. A simple fracture is relatively easy to treat. For example, a closed transverse fracture of the tibia, while a fracture in the multiple pieces, which is relatively difficult to treat, is called a complex fracture. Example is comminuted fracture of intra-articular, fracture of the proximal tibia. A fracture is said to be complicated if associated with the damage of neurovascular structures, and the type of fracture require emergency treatment. Sixth classification of fractures is on the basis of quantum of force. In this classification, the causes of fracture may be classified into the following: high energy or high velocity injury is caused by severe trauma, force injury, example RTA, that is road traffic accident. Normally, these fractures are associated with severe soft tissue injury with extensive devascularization of fracture ends. These are usually complex and it is difficult to treat. Such a fracture are often unstable and slow healing. Low energy, low velocity injury. It is caused by mild trauma. The first example, a fall from height could be associated. This is associated with soft tissue injury. That's the end of our presentation today. This is all about fracture types and their mechanisms. If you please like this presentation or found it very helpful, please subscribe to our channel so that we can provide you more of these videos.